So in this video, we're going to be going through the key ways to manage your hip bursitis, or for those people who've got pain on the side of the hip that are worrying about what to do and how to manage it. So we're going to go through that now. Now, hip bursitis is a big problem. It's a huge burden on people and commonly presents when you've got pain on the side of the hip here. So if you fit that criteria, you're that person, you're that patient who's got real specific pain on the side of the hip that is persisting, that is grumbling, that's going on for a while, this video is for you. Because we're going to go through that absolute fundamental key points to consider really when you're trying to get on top of this problem. Now, let's just kind of cover the basics first and foremost. Historically, people have always been blamed the bursa as their problem. Now on the side of the hip here, you've got this little bony prominence that sticks out. It's called the Greater trochanter. Now on top of that, there are tendons that attach onto it, and essentially underneath that tendon is this little bursa. So this bursa, this bursitis, historically has always been blamed for what's caused the pain on the side of the hip. However, what we understand more now, and something I've actually gone into a bit more detail in a video, I'll link it above now if you want to watch that. But what we understand much better now is that majority of the time, it's not really the bursa that we're dealing with, it's a tendinopathy. And it's something called the gluteal muscles, or the gluteal muscles. You might, look, we all know the glute max, right? Everyone knows the glute max. Now there's two other smaller glute muscles on the side of the hip, the glute medius and the minimus. And commonly the thing which is implicated within this is a glute medius. So you get a glute med tendinopathy, and it's that tendinopathy, the tendinitis, tendon-related pain, which is the thing that contributes predominantly to someone in pain. Now this thing can be so painful and so stubborn, and often the history, the narrative, the presentation that people who suffer with this have really common narratives and histories. They've got constant, real deep nagging pain on the side of the hip, and that constant aching pain can sometimes spread down the side of the leg. Sometimes it can alter their way that they move and walk. That can then lead to them having back pain, and then you're trying to figure out, is it the back causing the hip pain? Is it the hip causing the back pain? Sometimes it coexists with a hip joint condition as well, and then you're thinking, well, is it one causing the other, or is it one referring to the other one? And it can make the whole picture a little bit unclear, a little bit muddy. But when you're dealing with the actual glute tendinopathy, there are real key things that are better to do from a management perspective, and some things that probably aren't like the best thing to do. They're not necessarily unsafe, but you've got to optimize your outcomes. Now you've got to think about this, right? This whole recovery can take a while. You've got a glute tendinopathy problem that in itself, really the natural history and the progression of it can take months up to a year or even over a year really to get a full resolution. So it can be slow, it can be stubborn. But what you have to do is follow the key principles. You need to do the right things, you need to try and mitigate it getting irritated, and also you've got to give it time. And these three things really you have to do all together. It's hard to kind of do one and ignore the other. It's a struggle. So what we're going to go through now is some of the key things that I think will work best, and the key management principles that often allow you to get a good recovery, that hopefully will allow you to respond well from it. Now, I've already said to you that the primary thing is a tendon problem, a tendinitis or a tendinopathy, whatever you want to call it. In order for us to make that tendon better, we have to make it change. We have to try and improve and increase its tolerance. So like you're struggling to walk, you're struggling to lay on your good side, you're struggling to put your shoes and socks on, go up and down stairs. Essentially what that is you're struggling to put it on a stretch. So you're struggling to stretch that tendon because it hurts so much, but then also you're struggling to contract it. So when you're trying to put your shoes and socks on and you're rotating your leg up and you're trying to put it on your lap, or you're trying to do a movement, or you're trying to move your leg, or you're trying to do an activity or an exercise where you're contracting the muscle, but then you're struggling to do it because it hurts. So you've got an inability to stretch it and an inability to contract it. And those things, due to the pain that you've got, often will mean that your physical tolerance diminishes. So you have a hip that might have been able to go for a hike or a walk and cycle, or all of a sudden, actually you can't do too much. The day-to-day fundamental stuff that you want to do, that you could do, you can't do now, and the most rudimentary tasks become a problem. So the tolerance is dropped. So what we have to do is essentially build up that tolerance back up, and that's when exercise comes into play. Now, when we're talking about exercises for glute tendinopathy, you need to consider that there are different levels to it. Now, there are great exercises that you can do that adjust for the glute med, and they'll work great. But for a painful hip and a hip that's really sore when you're trying to activate and use that area, all the exercises cannot just be glute med, glute med, glute med. It'd be too much of a good thing. But also you have to pick and have exercises that are going to be good enough to give you an outcome, but not hard enough that it's too painful. And it's that balance. And I want to talk about pain with exercise here as a key point, because what's really, really vital for patients to understand is this. You may be a patient who's developed this, and there are loads of risk factors that I've discussed in the prior video, but there are loads of risk factors, and you could be a patient who possibly doesn't exercise that much that's developed this problem. And your ability to want to do it is high, but your ability to do anything is low because it's so painful. So what we have to consider is this. Certain exercises that you do from a rehab perspective may give some side effects, like you might get a bit of aching in your muscles, you're doing things that you've not done before, and you might get this delayed muscle soreness, and that's normal. That doesn't mean you've injured it, that doesn't mean you're doing anything bad. But equally, what you want to do is understand that when you're doing some of your rehab exercises for this tendon, that sometimes your levels of symptom may fluctuate. Now, it's okay to have a slight bit of discomfort when you're doing it, and for a short period of time afterwards. That's completely safe. But what you don't want to do is have exercise makes pain worse, pain then persists, then you're in pain for a week. That's obviously too much. Doesn't mean you're doing the wrong thing. It might just be the dose, the number, the reps, the sets. Something might just be off a little bit. And it's about trying to realign that. But the focus here now is trying to build that resilience up. And that's really challenging to do when the treatment is only passive. Massage, acupuncture, cupping, all that kind of stuff. That's fine from a symptom management perspective, but it's not going to resolve it long term. We have to get that physical tendon tolerance back up, and that comes back down to doing those exercises. Really particular exercises that will help, but also functional global things that will help that individual or you become more physically tolerant. And what happens, think about this, right? What happens, you're in pain for a long period of time. Physically, your ability to do stuff diminishes. Well, what's that going to do? Well, then emotionally, mentally, psychologically, that's going to start to get involved as well. Because if you can't do the things that you want, if you're in pain for that long, if it's impacting your sleep, impacting your quality of life, there's no doubt that it's going to start to impact your emotional well-being. So on one hand, we know that the inability to do stuff impacts the psychology, but that's exactly what the physio is all about. Trying to get you physically better, but also trying to get you more psychologically resilient and also psychologically better by doing these exercises. It comes hand in hand. But me saying that also has to highlight the fact that there are certain things that you could do that you might be given, that you might find on YouTube and Instagram, TikTok, all of the stuff, that are sometimes pitched at that you've got bursitis and go and do this for bursitis, where I've already said, less than 5% of the time the bursa is the primary problem. We're talking about glute tendinopathy. And some of those videos, some of those exercises might actually be the catalyst of what makes this sometimes a little bit more irritable. Now, the thing that you don't want to be doing in the early stages is really deep stretches, because sometimes that can really flare it up. Glute stretches, piriformis stretches, foam roller, tennis ball, golf ball, prodding it, poking it, IT band work. Sometimes it might make sense that that will loosen it up, but actually it makes things worse. It irritates it. Now, the caveat to this, the absolute fundamental thing to consider with this is none of those things are bad. They're not unhealthy, they're not unsafe, but for that moment, at that time, they're probably not the best things to do. So you have to understand, if we want to get that physical tolerance back up, if we want to improve that psychological well-being and quality of life, you don't want to be doing stuff that's painful all the time. You want to do stuff that's going to allow you to be motivated, stay adherent to the plan, be consistent. And to do that, you have to pitch that rehab at the right place. You have to reason what you're doing in the right way. You have to be aware that certain things will probably provoke it. Doesn't mean you avoid it forever. It just means for the here and now at that stage, maybe we have to push those to one side for a minute. Don't do loads of stretches. Don't do loads of things that irritate it. Focus on physically being better. Focus on functionally getting stronger. And then we reintroduce those stretches back in gradually over time. Because ultimately, the outcome is normality. You should be able to stretch it. You should be able to do those things. But in a hip that's painful because they've got glute tendinopathy here, we have to pitch it. And you've got to do the right thing at the right time for the right amount. That's when you start to see changes. That's when you start to see outcomes. But unfortunately, patients really can struggle with this. You could be doing everything I've just said. You could be listening to this and thinking, Mehmet, you're telling me what I already know. I've done the exercises. I've seen a good physio. I've done all the right rehab. I've not been stretching it. I've not been hammering out the glute foam roller type stuff, but my pain is still high. You could be crying, emotional, not sleeping, impacting your relationship, impacting your mood, impacting all of those factors of quality of life. And you're doing all the right stuff and it's still not getting any better. But at that point, there are still options. At that point, you need to consider the fact that, well, one, are we actually dealing with what we think we're dealing with? And that's the clinician's job, to take a step back, reevaluate, look at the bigger picture and think, is it actually this? Are we actually dealing with a glute tendinopathy? Let's say you've confirmed your hypothesis and now we know what we're dealing with. You've still done the physio, you've left it a long time, you've varied it, it's still not recovering. Then you've got options. You've got things like shockwave therapy that can be, in some cases, quite effective, but there's limitations to access and you've got to pay for it and not everywhere does it and you have to have it multiple times. So there's pros and cons to that. And then you've got injections. Now, a steroid injection could be quite beneficial, but the steroid injection is not the cure. Albeit it's safe, you could do it once in a while, it's not the end of the world, but it has to be for the right person because a steroid injection for this kind of problem is not a cure. This is an adjunct to allow you to do the stuff which is going to be the cure long term, which we've already said is that physical rehab, that improvement of physical tolerance. So that injection could be the catalyst to break the cycle of being in chronic persistent pain, but that's going to be the opportunity for you then to jump in to do the exercises, to then do the things that you know are going to hopefully help it long term. Because I've said to you already, remember, the tendon is weaker. We want to get the tendon stronger. Putting a needle in it isn't going to make it any stronger. Massaging it, doing acupuncture isn't going to make it any stronger. But sometimes those adjuncts may well be the thing that allows you to do the longer term strategy, the longer term plan of actions that you want to do. This can be a stubborn problem. Now, if everything that I'm saying to you is starting to resonate, you're thinking, this does sound like what I think I've got. And I have to really kind of like highlight this is you can't use YouTube or Instagram or social media to diagnose things yourself. Always get help, always get support from a clinician. Just get that support and guidance from someone that you trust, that you know sees these things regularly so you can get the right input. Equally, I've got other videos on here as well that might help with things like rehab advice and guidance, especially for things like this. But it's not a recipe. It's not a one size fits all. These videos, not necessarily these ones, but other ones I've done on this channel, which have exercise advice and guidance and me demonstrating exercises, they're just bits of insight and advice. You cannot use them as a recipe. But what I do want to highlight from this video in particular is that there are certain things that you can do that work better and really other things that probably aren't going to be best suited for that. But I want to hear from you guys. If you're watching this and you're thinking, all of this kind of fits me, this is my situation, this is what I've done. I want this channel to be a bit of a community and we've got loads of great comment interactions on the other videos. I want you to comment and let me know, does this fit for you? Does this make sense? And also what's worked and what hasn't worked for you so we could really share the message wide.